if I may sort of shift our discussion now to Canada and Canada's role in WHO. And so I think I'm sure, have heard this phrase that Canada has been dubbed a middle power in the international sphere, providing a lot of moral leadership and promoting diplomacy as a solution to achieve global problems. But its presence hasn't always been considered to be as optimal. And I just turned, if anyone's interested, there was a very good supplement in The Lancet back in 2018 that took a critical look at Canada's successes in the global health realm, including our own universal healthcare system that has some of its own challenges, our role in leading the development of the Ebola vaccine. So there are many sort of accomplishments also on the research front. So as WHO looks to strengthen its leadership in global health, what do you think is the opportunity, and there may be more than one, of course, for Canada to shape the global health agenda? And what role can our country play in a revitalized WHO, which, of course, as you alluded to, is already in transformation?
Yeah, thank you, Erica. So, just up front, I have to say WHO treats all its 194 member states the same. I'm an international public servant, and I think about every country the same. I'm also a proud Canadian. I think, Canada's always had an important role in WHO. I think most of your students probably know, but I'm not sure, you tell me, that the first Director General of WHO was a Canadian, Brock Chisholm. And so Canada's been there right from the beginning. It's had a strong set of relationships for 72 years. The focus on polio, maternal, newborn, and child health, et cetera, et cetera. So Canada's always been there with WHO, and Canada's always been a strong proponent of the multilateral system. And if there's one thing I've learned through COVID, it's the importance of the multilateral system and the importance of WHO, especially for the most vulnerable people in the world. I don't want to presume to say to Canada what Canada should do. That's up to Canadians, that's up to the government of Canada. But let me talk about some of the things that have already happened that are obvious in terms of the strategic basis of the relationship. Firstly, Canada has joined, as I mentioned, COVAX. It's been a strong proponent of the ACT Accelerator. The Prime Minister was there at the launch, and I think that's very important, and especially with the scientific prowess, and this takes me back to my earlier life that Canada has. Do you know, for example, that in 1955, or just after 1955, some of the early lots of the Salk vaccine for polio that were used in trials around the world and in Canada were produced at Connaught Laboratories, which was part of the University of Toronto. So there's a history there. Anyway, so the search for a vaccine, the search for scientific tools, the participation in that is something Canada has already declared itself on. Secondly, primary health care. And I tried to make that point. There is a readout that you can find on the internet of a conversation between the development minister and Dr. Tedros from about 2 or 3 months ago that actually emphasizes the potential role in primary health care. Underlying that, Canada is a strong proponent of the multilateral system. So I mentioned the Global Action Plan for Healthy Lives and Wellbeing. That's 12 multilateral agencies that want to have stronger collaboration for better health, supporting countries. So that anyone who supports multilateralism would have to support that, because that is the multilateral system. Then, of course, Canada's focus on gender equality, on climate, play into the whole relationship in ways I've described. And more broadly, I mentioned that this was a crisis of historic proportions of lives and livelihoods. And one of the things you could see, if you look at Canada's record of support over the past 6 months, it supported for example, World Food Program in issues of hunger. It supported other humanitarian agencies with a focus on the most vulnerable people, migrants, refugees, and so on. And this has all been, I think, extremely important. So, Erica, it's not up to me to determine.
Oh, of course, I wasn't.
On the other hand, but on the other hand, I think if we look at the recent record of what Canada has done, even in the past 6 to 12 months, and I've only cited things that are publicly available, you can start to see a really important pattern of cooperation and support, mutual support between Canada and the World Health Organization, which, as an international public servant and a WHO senior official, I'm delighted by, and as a Canadian, I feel proud of.
That's great. Yeah.